Feeling overwhelmed by the NCLEX Maternal and Child Health section? You're not alone. Hello, I am Nurse Miriam. Welcome. This OB Peds portion covers everything from pregnancy to adolescence, blending complex physiology with psychosocial care. You must master these high-yield topics to boost your NCLEX score. In this video, we'll break down essential concepts: labor, newborn care, pediatric milestones, and safety into manageable pieces. Let's get started and turn your anxiety into confidence. To ace OB questions, you must be fluent in labor and delivery terminology. Terms like gravida, para, effacement, dilation, and station are critical for interpreting patient status. For example, G3P2 means 3 pregnancies, 2 births. Effacement is cervical thinning. Dilation is cervical opening. Station is the baby's position in the pelvis. Know the difference between antepartum, intrapartum, and postpartum, and recognize complications like preeclampsia or placenta previa. Use flashcards and repetition to drill this vocabulary until it's second nature. When you see prolapsed cord or boggy fundus, you should instantly know the emergency interventions. Mastering this language lets you quickly identify the core issue in any NCLEX scenario. Invest time here. It pays off on every maternal health question. Please subscribe for more NCLEX content. Interpreting fetal heart rate, FHR, strips is a must-have skill for the NCLEX. Analyze for baseline rate, 110-160 beats per minute. Variability, moderate is best. Accelerations and decelerations. Use the VL-CHOP mnemonic. Variable, Sion's cord compression. Early, C head compression, accelerations. OK, L for late. Placental insufficiency. For variable decelerations, reposition mom. For late decelerations, turn her to the left side, give oxygen, increase IV fluids, and stop oxytocin. Early decelerations, just document practice, not just naming patterns, but knowing what action to take. Think Lionel for the left side, I for the IV fluids, O for oxygen, N for notify provider. This systematic approach turns a scary fetal heart monitoring strip into a clear plan. The NCLEX tests your ability to recognize and act. So drill these patterns and interventions. Confidence comes from practice. Know the 4 stages of labor and your nursing priorities for each. Stage 1, cervical dilation, latent, active transition phases. Focus on education, pain management, and support. Stage 2, pushing and birth coach, effective pushing. Monitor fetal response and prep for delivery. Stage 3 is the delivery of the placenta. Watch for placental separation. Stage 4, immediate postpartum, monitor for hemorrhage, check fundus, assess perineum, and promote bonding. Recognize signs of complications at each stage. Clear knowledge of these stages helps you answer any labor scenario on the NCLEX. Remember, each stage has unique priorities. Know them cold. Use Bubble He for systematic postpartum assessment. Breasts, uterus, bladder, bowel, lochia, episiotomy, hormones, sign, hemorrhoids, emotional status. Check breast for engorgement, nipples for cracks. Uterus should be firm and midline. Bladder empty to prevent uterine atony. Assess bowel sounds and movement. Lochia color and amount. Rubra, serosa, alba. Perineum for Rita, meaning redness, edema, ecchymosis, discharge, approximation. Watch for DVT signs in legs. Assess emotional status for postpartum blues or depression. A boggy uterus signals atony, massage immediately to prevent hemorrhage. Each component has a purpose. Know what to do if you find an abnormality. Bubble. He isn't just a checklist, it's a life-saving routine. Master this assessment for high-yield NCLEX questions. Quick, focused checks save lives. Whether a mother chooses breastfeeding or formula, your job is to provide evidence-based, non-judgmental support. Breastfeeding offers immunity and bonding. Teach proper latch, feeding cues, and signs of adequate intake. Formula is safe when needed. Teach correct preparation. Never prop bottles, and emphasize the importance of frequent burping. Know the contraindications for breastfeeding, e.g., HIV, chemotherapy. The NCLEX may test your ability to identify feeding problems or teach safe practices. Focus on empowering parents and ensuring a thriving baby. Immediately after birth, priorities are airway, breathing, and thermoregulation. Assign APGAR scores at 1 and 5 minutes. Suction mouth, then nose if needed. Dry the baby. Provide skin to skin and use a cap or warmer to prevent heat loss. Administer vitamin K for clotting and erythromycin eye ointment to prevent infection. Assess vital signs and reflexes. Monitor for normal heart rate, respirations, and temperature. Teach umbilical cord care. Keep it clean and dry. These interventions are high yield and often tested. Know the sequence and rationale for each step. Know the major physical, language, and social milestones for infants, toddlers, preschoolers, school-aged kids, and adolescents. For example, roll over by 5 months, sit by 6 to 8 months, walk by 12-15 months, speak in sentences by 2 to 3 years. Use mnemonics, charts, and flashcards to memorize key ages. The NCLEX loves to ask if a child's development is age appropriate or if there's a red flag. Spotting delays is critical for early intervention. You don't need every detail, but know the big milestones and warning signs. This knowledge is fundamental for safe pediatric care. Pediatric safety is all about correct medication dosing and injury prevention. Always calculate meds by weight in kilograms. Double check your math and know safe IM injection sites. Vastus lateralis for infants. For infants, focus on safe sleep and choking prevention. For toddlers, childproof the home. For older kids, teach safety relevant to their age. The NCLEX will test your ability to match safety risks and interventions to developmental stages. Think, what can this child do and what dangers does that create? Know common pediatric meds and administration tricks. Safety is always the top priority. Practice these calculations and scenarios for exam success. Use the nursing process, ADPIE, and Maslow's hierarchy to answer NCLEX questions. Always assess first, do not act without data unless it's a true emergency. Prioritize physiological needs, airway, breathing, circulation before psychosocial ones. For priority questions, ask, what's the most immediate life-threatening issue? Use Maslow's pyramid to filter your choices. This approach helps you cut through distractions and pick the right intervention. Frameworks like these are your secret weapon on the exam. Mastering NCLEX style questions, especially SATA and priority, is all about practice. Treat each SATA option as true, false. Do not guess how many are correct. Review rationales for both right and wrong answers to understand your thinking. Use a QBank daily for consistent practice. For priority questions, always return to ABCs and Maslow's. Don't stress about low scores at first. Focus on learning from mistakes. Patterns will emerge as you practice, making you faster and more confident. Active practice bridges the gap between knowledge and passing the exam. The maternal and child health section is manageable when you focus on key concepts and frameworks. Use mnemonics, prioritize safety, and practice with NCLEX style questions. Deep understanding, not just memorization. Build your confidence and clinical judgment. Download your free NCLEX Ultimate Study Guide at nursecareerblueprint.com for more tips and resources. You've got this, one section at a time. Please subscribe. Thanks for watching.